Otitic hydrocephalus is a rare but serious complication of chronic otitis media. It is characterized by increased intracranial pressure without hydrocephalus on imaging, typically occurring after an ear infection. This condition underscores the importance of recognizing and appropriately managing middle ear infections to prevent severe neurological outcomes. The pathogenesis of otitic hydrocephalus involves chronic otitis media that leads to thrombosis of the venous sinuses, particularly the transverse or sigmoid sinuses. This thrombosis impairs cerebrospinal fluid absorption, causing a buildup of pressure within the brain. Additionally, inflammatory mediators from the infection may further disrupt normal cerebrospinal fluid dynamics, contributing to elevated intracranial pressure without ventricular dilation. Patients with otitic hydrocephalus often present with symptoms of increased intracranial pressure. These may include persistent headache, nausea, vomiting, and visual disturbances such as blurred vision or papilledema. In severe cases, altered mental status or cranial nerve deficits can occur. It is critical to recognize these symptoms in patients with a recent history of otitis media, especially if neurological signs are present. Diagnosis of otitic hydrocephalus relies on clinical suspicion and imaging. A CT or MRI of the brain typically shows normal ventricular size, distinguishing it from other forms of hydrocephalus. However, venography may reveal venous sinus thrombosis, a key feature. Lumbar puncture often shows elevated opening pressure, confirming increased intracranial pressure. It's important to exclude other causes of raised intracranial pressure, such as intracranial masses or infections. Treatment of otitic hydrocephalus involves addressing both the increased intracranial pressure and the underlying ear infection. Antibiotics are essential to treat the primary otitis media, and anticoagulation may be indicated if venous sinus thrombosis is confirmed. In some cases, surgical intervention, such as mastodectomy, may be required to clear the infection. Managing intracranial pressure can involve acetazolamide or other diuretics, and in severe cases, surgical procedures like shunt placement may be considered. Otitic hydrocephalus is a rare but potentially life-threatening condition that highlights the complex interplay between otologic and neurological health. Early recognition and intervention are crucial to prevent long-term complications. For medical professionals, understanding the link between ear infections and intracranial pressure abnormalities is vital for timely diagnosis and management.